Well, I invite you all this morning to imagine with me for a few minutes. Imagine that there was a man who lived 100 years ago, and he said before he passed away, I believe that it's within every person's power and responsibility to do everything we can to alleviate human suffering. Imagine this man was so thoughtful and generous that he left his fortune to do just this. Imagine today, imagine that there's a children's hospital with a concept. Imagine that there's the state of Florida where there's 4.2 million children, third only to Texas and California. Imagine there's not a single top-rated children's hospital for those 4.2 million children. Imagine there's programs that are being developed where orthopedic surgeons are now part of a team providing more pediatric surgery, orthopedic surgery, than any team in the state of Florida. Imagine there's a team of pediatric radiologists reading more pediatric images than any program in the U.S. Imagine there's a team of cancer specialists caring for more children with childhood cancer and blood disorders than any program in Florida. Imagine there's a cardiology team that's the largest, most well-distributed group of cardiologists in the state of Florida. Imagine there's a neurosciences program performing more neurosurgeries than any program in the state of Florida. And imagine they've also recently recruited the most talented person in the room, Dr. Myron Roll. And imagine this children's health system says, we can do more. We can go well beyond medicine, recognizing that 80% of a child's well-being happens outside of the walls of a hospital. Imagine they've partnered with community resources such as the Ginsburg Institute to say, how do we go into our communities to make a difference? Imagine this same organization is partnering with the University of Central Florida and that we're training the best in the nation, recognizing that we have a shortage of physicians, but especially pediatric physicians for the beautiful state of Florida. We are training now. I looked at my 2025 budget and I had 85 FTEs in the budget, and I thought, wow, how did we get here? This doesn't count all of Dr. German's students that the third and fourth year rotations happen at our hospital. These are pediatric residents and fellows that are committing their career to improving the well-being of children. It also doesn't include the 200 trainees that we welcome from other training programs every year for a pediatric experience. Imagine this hospital is also partnering with great health systems such as Wendy Brandon's and all of the Central Florida HCA hospitals to bring pediatric expertise to the most vulnerable. Imagine that team is also investing in research, recognizing that that team ranks 14th in the nation when it comes to NIH grant-funded research, but we want to be in the top 10. Imagine that team is doing the great research that you heard Dr. German mention a minute ago, where Zika virus will cure certain types of pediatric cancer. And I just sat with a family this week who gave us a $6 million contribution to further that research. Imagine there's this hospital, this health system that's investing in clinical, in teaching, and in research in the ways I described so that we can create the best, a top-tier children's hospital for Florida's 4.2 million children. And we're doing it not just on the Lake Nona campus, but we're doing it in our communities. Imagine that everything that I just described is happening here in Lake Nona. We're grateful to be here, and I'm grateful to share my comments with you today. Thank you.